What do spikes and sharp waves mean on an epilepsy EEG? Imagine your brain as a busy city with electrical signals constantly flowing like traffic. Sometimes, during an EEG test, doctors see specific patterns called spikes and sharp waves. These patterns are important clues in understanding epilepsy. Spikes are quick bursts of electrical activity that last only about 20 to 70 milliseconds. Sharp waves are similar but last a bit longer, up to 100 milliseconds. Both show that certain parts of the brain are more active than usual. When these patterns appear, they often indicate increased excitability in those areas, meaning the brain is more prone to producing seizures. These spikes and sharp waves can be localized to one part of the brain, like the temporal lobe, or they can be spread across both sides, which suggests generalized epilepsy. Sometimes, these patterns are seen even when a person is not having a seizure, which helps doctors diagnose epilepsy even if the person is not actively seizing during the test. Finding these patterns can also give clues about how severe the epilepsy might be, how likely it is to respond to treatment, and what the long-term outlook might look like. It's important to understand that spikes and sharp waves are not exclusive to people with epilepsy. They can sometimes appear in individuals who have had brain injuries, strokes, or brain tumors, even if they do not have seizures. However, in someone with a history of seizures or symptoms suggestive of epilepsy, these patterns are considered strong indicators of an underlying seizure disorder. In essence, when doctors see spikes and sharp waves on an EEG, it means certain parts of the brain are more excitable and may generate seizures. These patterns help in diagnosing epilepsy, pinpointing where seizures might start, and guiding treatment options. Remember, interpreting these patterns always depends on the person's overall medical history and symptoms, so it's essential to consult a healthcare professional experienced in epilepsy care. If you or someone you know is undergoing an EEG, understanding these patterns can help demystify what the test reveals and support informed discussions with your medical team.